Good evening. Thank you for joining us. I'm Yoon Jung-min. Some professors at the nation's major hospitals halted medical services on Tuesday for one day amid their extended conflict with the government. Not much chaos has been witnessed at hospitals so far. Against this backdrop, the deadline for medical schools to submit the number of future students closed today. Eun-hee has the latest.
Medical professors at Severance and Seoul National University hospitals took a day off from work on Tuesday, following a decision by all such professors to reduce their weekly working hours. According to local media, however, there were no signs of the anticipated chaos, as overall participation was not significant at either hospital. An official at Seoul National said the action did not significantly interfere with patient care because it was not a collective action, but rather participation by professors on an individual basis. A Severance hospital official noted that professors there needed to adjust their schedules with patients directly, and so many continued to work as usual. The remainder of the so-called Big Five hospitals will also see professors taking one day a week off, pausing surgeries and outpatient treatment. But emergency and intensive care treatment will continue for people and other inpatients. Professors at Asan Medical Center and the Catholic University of Korea's Seoul St. Mary's Hospital will take Fridays off, while those at Samsung Medical Center will take days off based on their work schedule. Prolonged fatigue among medical professors covering for thousands of trainee doctors who left their positions in late February could see some take more than one day off. The doctors are protesting the government's plan to expand the medical school admissions quota. The government has deployed public health and military doctors to fill the void left by medical professors and junior doctors. Meanwhile, the health authorities, who have been checking on operations at hospitals to decide on whether to deploy more people on Tuesday, have not given any updates. This is because no hospitals have completely halted their medical services. While assuring no major gaps in medical services, the government is standing firm, urging trainee doctors to return to work and professors to remain with their patients, adding the government is always open to talks. Meanwhile, the deadline for medical schools to submit the number of students they will accept next year also falls on Tuesday. The total expanded number is expected to be around 1,500 to 1,700 students, as most private universities are expected to fully accept the government's quota expansion plan, while national universities are leaning toward a 50% increase. With the expansion of medical school places close to the government's target of 2,000 students, attention is turning to how the professors, trainee doctors, and existing students will respond. The final number will be sent to the Korean Council for University Education. Eun-hee, Arirang News.